There are a lot of complications that can arise during pregnancy, but preeclampsia is among the most dangerous. It affects 1 in 25 pregnancies in the U.S., and the CDC reports it's responsible for 70,000 maternal deaths and 500,000 fetal deaths worldwide each year. And the list of risk factors is frightening.
Unfortunately, preeclampsia is a very complicated disorder, so there are many different risk factors. Of course, many women have a family history of it. They have a personal history of having it with a prior pregnancy. The risk is increased if it's an IVF pregnancy. The risk is much higher in women of color, as well as advanced age, obesity, and many other conditions like type 2 diabetes, kidney disease, liver disease, and autoimmune disorders.
The number of risk factors, coupled with the fact that symptoms can go undetected, is the reason it's so difficult to diagnose.
Most symptoms of preeclampsia are not felt by the woman, or she thinks it's just a normal part of pregnancy. Most of us, as you know, can't feel our blood pressure and can't tell if we're becoming anemic, as an example. This is one of the reasons why it's important for your doctor to think through that list of risk factors we discussed and determine whether measuring and monitoring your blood pressure, doing an ultrasound, or doing a variety of laboratory tests is important to identify your risk of preeclampsia and other possible challenges.
So, early screenings can mean the difference between life and death.
LabCorp has recently launched 2 protein-based blood tests where we can measure how well your placenta is developing blood vessels, and that helps us determine the risk of developing preeclampsia by the 34th week of gestation of the pregnancy. The research suggests the best time to test these different proteins is between the 11th and 14th week of the pregnancy. The good news is if your doctor determines that you are at an increased risk, then they can do a variety of things to try to reduce the risk of a problem. Most importantly, of course, aggressively treating the high blood pressure with one of the medications that we know is safe during pregnancy. Many doctors would give a low dose of aspirin to a woman in that situation to reduce the risk of blood clots and other challenges, as well as look at your activities of daily living, how much exertion you have in your job if you're still working or in other activities of life. Take good care of all the other underlying conditions you might have, such as your diabetes, to try to increase the risk of a healthy delivery.
Go to labcorp.com for more information and risk assessment.